Ladies and gentlemen, we seem to be still short a couple council members, so if you happen to see any, feel free to give them a hug and send them this way in case they're lost. Yep, we got another one. Yep. Hi, everybody. We're going to commence the meeting. I know this earlier start time may have thrown folks off, but why don't we get underway? And I think our colleagues will find their way to the chambers soon enough. You know, there's been some change in schedule, and that may have caused a little bit of confusion. But I know we've got folks reaching out to council offices to make sure everybody makes it here to join us. So we'll call the meeting to order for the morning of November 30th. And if you're able to stand, please rise for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America, and to the republic which stands one nation, under God, indivisible, with liberty and justice for all.
I'm going to go ahead and send invites to Sergio.
Thank you. Today's invocation will be provided by Pastor Jordan Wong, who's the senior pastor at Almaden Neighborhood Church, and we're grateful to have Pastor Wong join us today.
Great God, we thank you for this day that you have blessed us with. Each moment that our lungs fill with air, each moment that our hearts beat within our chest is a gift to us from you, and we do not take it lightly. I pray for all of us that we may stand in gratitude and with thanksgiving with the blessings that you have given to us, that we may bless others. Thank you for the proceedings that will happen in this room and the opportunity to serve and better the city of San Jose. I pray for every person in this room, everyone that will be entering this room, and everyone who is joining online, that together there will be a spirit of collaboration, humility, and love. We give you our agendas and our plans for you to lead us to make decisions this day that will be best for all people. And God, I pray at the end of this day for each person in this place as we leave this time, that every single one will have a sense of accomplishment, a feeling that they have contributed to the greater good, and a stronger sense of hope for this great city. Unity, harmony, and productivity takes a miracle, but you are the God of miracles, and that is why we call on you. Thank you for your blessings in this city. We pray this in your holy name. Amen.
Amen.
Amen. God bless you.
Thank you, Pastor Wong. Thank you for your words. All right, we're on to ceremonial items. We'll begin. Councilmember Foley has invited various members of the team at the family court, including two of our distinguished judges. We're happy to have them. We're going to recognize and proclaim Family Court Awareness Month.
Good afternoon, everyone. I'm Councilmember Pam Foley, and I represent San Jose Council District 9. Today, I'm proclaiming November as Family Court Awareness Month. We all remember the Brutalist building. Well, it's not there anymore, but Family Court is strong. Family Court is a specialist court designed to deal with legal problems arising out of family relations such as domestic violence, divorce, or child custody. The mission of Family Court Awareness Month Committee is to increase awareness of the importance of a family court system that prioritizes child safety and always acts in the best interest of children. With an emphasis on education on domestic violence, child trauma, and post-separation abuse for all professionals working within the family court system. Focusing on empirical data that is currently available is important for judges and family court professionals and are critical components to making decisions that truly advocate for the safety of children in Santa Clara County and beyond. It is the goal of the Family Court Awareness Committee to create awareness within communities, as the family court process can be an isolating journey and many are suffering in silence. With this proclamation, we shine a spotlight on all that the family court system does and advocate for the incorporation of more empirical data and research in their decisions and rulings. Today, we welcome the Honorable Judge Charles Adams, Judge Bleicher, and we have two representatives from the Bar Association who represent the Family Law Division, Alistair Shaw and Patricia Zerbini. With that, I'd like to turn over the microphone to Judge Adams and ask the mayor to present the proclamation.
Well, thank you. I did want to first start by thanking the mayor, thanking Councilmember Foley, the other members of the council for recognizing Family Court today. As Councilmember Foley said, Family Court is a difficult place to work, and we have to make some decisions that aren't pleasing to everyone. But we always try and do that, keeping in mind that we want to keep everyone safe, particularly children. And on behalf of the court, I did want to thank everyone again. And also just to let you know that we're very happy to receive this today. This is something that I think is important for the community to understand the work that is done in family court, and that overall we're doing the best we can just to keep families safe, to make the best decisions we can, and we really appreciate receiving this today. Thanks so much. Thank you very much, Mr. Mayor. Thank you.
All right. All right, Councilmember Arenas is here to present proclamation for Human Rights Day and International Day to Eliminate Violence Against Women. And so I welcome members of the community. Thank you.
Wonderful. Good morning, everyone. I am so honored to recognize and retroactively proclaim November 25th as International Day for the Elimination of Violence Against Women and December 10th as the International Human Rights Day. This is the second year that I've had the privilege to introduce this proclamation, and behind me is standing some really strong women who do work throughout the whole year on our behalf. The City of San Jose has participated in the past with the United Nations to End Violence Against Women campaign. This was from November 25th and it runs on December 10th. Like I said, it's a Human Rights Day on December 10th. And it's an initiative of 16 days of activism against gender-based violence and concludes on the day that commemorates Human Rights Day. But we should make sure that we fight for women's rights every day. Violence against women and girls is one of the most widespread, persistent, and devastating human rights violations in the world today. 1 in 3 women and girls worldwide have experienced physical, sexual violence in their lifetime, and it's very similar in the US. It's 1 of 4 young girls and women experience that before the age of 18. And as you've just seen in the presentation before me, that was for family court, and that's where our young girls end up because they are disproportionately subjected to violence, femicide, sexual violence, intimate partner violence, and trafficking. And less than 40% of the women who experience this trauma seek help, and the violence disproportionately affects lower income women. And so in order to really eliminate this, we must begin here at home and in the way that we're doing. I was speaking to Judge Lucero the other day, and she was so proud to share that this last week there were 0 incarceration for young girls in this county. And this is something that the county is moving towards in order to avoid this prison pipeline. Many of you are familiar with the school-to-prison pipeline that impacts young men of color. There is another pipeline that is not really spoken about, and this is a pipeline that impacts girls and young women. I encourage you all to read the report on sexual abuse, prison pipeline, the girl's story to learn more. One of the top reasons why young women interact with the juvenile justice system is because of past sexual trauma. And through our joint special meetings with the county based on gender-based violence and child sexual abuse, we are coordinating and improving our systems to better support survivors of these crimes. Our work to prevent and eliminate violence can't be done alone, as I said. We are fortunate to have partners in our community like the Zonta E Club of Silicon Valley, and they are committed to eliminating violence by mentoring and empowering young women in their community. They partner with local groups like Next Door, Somos Mayfair, YWCA, and here today, representing the Zonta E Club of Silicon Valley, is Clara Starr, which is the club president, Susan Ware, our club vice president, Faye Mellos, treasurer, and Kathy Paul, board member. Thank you for your commitment to empower women, and thank you for all that you do throughout the year. Let's give them a round of applause.
Good morning. Thank you to the entire City Council and especially Mayor Liccardo and Councilman Silva Arenas for putting a spotlight on gender-based violence with this proclamation and the lighting of City Hall orange to bring attention to domestic violence. The United Nations 16 Days of Activism Against Gender-Based Violence is an annual international campaign that kicks off on November 25th, the International Day for the Elimination of Violence Against Women, and runs through December 10th, Human Rights Day. The global theme for this year is 16 Days of Activism Against Gender-Based Violence is Orange the World, End Violence Against Women Now. It was started by activists at the inaugural Women's Global Leadership Institute in 1991 and continues to be coordinated each year by the Center for Women's Global Leadership. It is used as an organizing strategy by individuals and organizations around the world to call for the prevention and elimination of violence against women. In support of this civil society initiative, the United Nations Secretaries General Unite by 2030 End Violence Against Women campaign. Unite campaign calls for global action to increase awareness, galvanize advocacy efforts, and share knowledge and innovation. Thank you again to the City Council and members.
Finally, December 1st is World AIDS Day, and I know Councilmember Perales is on remotely, and Councilmember Foley is here in person. So we'll be presenting a proclamation to recognize this day. We're grappling certainly with a different pandemic. We must not forget this very important struggle for millions of us still. Councilmember Foley?
First, I'd like to turn the microphone over to Councilmember Perales. Are you here?
Hello?
There we go.
Hello, can you hear me?
Yeah, we're good.
Oh, all right, thank you very much. And my apologies, I'm battling, getting over a cold, and so I am remote today, but very, very pleased to still be able to offer up this recognition. So it's my pleasure to be able to recognize December 1st as World AIDS Day. Founded in 1988, World AIDS Day was the first ever global health day, establishing an opportunity for people worldwide to unite in the fight against HIV. World AIDS Day invites global communities to show support for the estimated 37.7 million people living with HIV and to honor the more than 35 million individuals who have died from AIDS-related illnesses. World AIDS Day, Silicon Valley brings together members of all communities for a series of free public events that provide support and awareness of AIDS-related illnesses. And I want to thank all of our partners who continuously seek to educate, provide resources, promote awareness, and to fight in getting access to HIV prevention and treatment for all those that need it. To further recognize and show support of World AIDS Day, my office, along with Councilmember Foley's, is lighting up the City Hall Tower and Rotunda in red. And I invite everybody to check out the lighting starting this evening after the sun goes down. And thank you to Councilmember Foley for being able to present that accommodation or the proclamation, excuse me, in person. And I'll turn it over to you, Councilmember Foley.
Thank you, Councilmember Perales, and thank you for partnering on World AIDS Day celebration with me. First, I'd like to thank the Silicon Valley World AIDS Day Planning Committee, who are here and present. And I hope everyone will join me in attending the event tomorrow, which is a candlelight vigil planned for 6 o'clock at City Hall Plaza. World AIDS Day is particularly important to me. My brother Tim died 25 years ago. AIDS was recognized as a severe pandemic about 40 years ago. And the play Rent was written 25 years ago. And if you're familiar with that, that has a very strong AIDS theme throughout it. I cannot watch it or think of my brother Tim or think of World AIDS Day without getting overly emotional. So I hope I don't get overly emotional. Tim passed away from AIDS during the early days of that pandemic. And I know my council colleagues, I've told them this story before, but It's really important on World AIDS Day that it bears repeating, because it is about those people who have passed before us, who passed from that pandemic, who were not able to benefit from the drugs that helped extend lives for many to follow. It was a different pandemic then. This is back when we didn't know much about that devastating illness, much less how to fight it. Those who contracted AIDS were treated like outcasts. There was fear of the unknown, fear as to how it was contracted, and fear over the ultimate death sentence. But that is no longer. HIV/AIDS is no longer a death sentence. And oh, how I wish and prayed that the cocktail would be available to Tim to prolong his life. Sadly, it came about around 6 months after he did pass. So it was, it's just the worst loss I've ever felt. My heart broke with his passing. But my heartbreak turned to passion to advocate for the LGBTQ plus community. To memorialize my brother, my daughter carries his name as her middle name. I still hold Tim very close to my heart. I have a picture in my office that I look out daily, and he's got a bottle of champagne in his hand, which is so Tim. He liked to live life large, and he is a message to me to live life large, to not take things too seriously, to forgive and forget, and to move on and embrace everyone with kindness and love. So I proudly proclaim World AIDS Day along with Councilmember Perales and my city council colleagues. Let's remember the millions we have lost due to HIV/AIDS, to the many millions living today with HIV/AIDS, and be thankful too for the progress we have made in fighting back against this horrific virus that causes AIDS. As we recognize World AIDS Day, let us remember that to end the HIV epidemic, we need equitable access and everyone's voices. I look forward to the day when there is a vaccine or a cure for HIV/AIDS. With that, I'm pleased to turn the microphone over to Bob Reed with the HIV Commission.
Thank you so much. Damn. There were a lot of people who died just before the cure, or before the treatment. There is no cure. But dang, there's some really good treatments out there right now. Thank you so much. Good morning. Good morning, Mr. Mayor and council members. Thank you so much for this opportunity. I'm Bob Reed. I've lived here in the beautiful city of San Jose since 1982. Contracted HIV somewhere around 85 or 86. I'm also a member of the Santa Clara County HIV Commission. World AIDS Day is a time to mourn those who have died from AIDS. And a couple of years ago, I attended a World AIDS Day. It was after the U equals U, undetectable equals untransmissible. In other words, people who take their medications are no longer infectious, at least by sex. And that just blew me away. And I spent a month crying, for those people who didn't make it to this point. But this year, I've been full of celebration. I'm so glad that I was one of the ones who did make it. And I'm thriving. I reached retirement age. And I went off of Social Security disability to regular Social Security. So I guess I'm no longer disabled. It was pretty cool. I never expected to make it that long. But it is, World AIDS Day is a time to celebrate all of the advances that we've made. And believe me, folks, it's dependent on pills. If you took away our pills, we would see a completely different world today. You know, the supply chain thing, I was worried, you know, is it going to hit our pills? If it does, we're doomed. I went for a month without my pills because they're toxic, and I almost died during that time. Anyway, on behalf of the Santa Clara County HIV Commission, and as a person living with HIV, thank you for the World AIDS Day proclamation. It will help assure that in San Jose, HIV will never be forgotten and will always be treated. Thank you.
Thank you for your words. Thank you. Thank you. Yeah, so I'll get around. Move this a little bit. All right, we're on to orders of the day. Are there any changes to the printed agenda from anyone on the council? I'm going to ask Tony if she sees anyone raising their hand online, because I'm just getting on myself now. No? Okay. Then we don't need a motion, so we'll move on to the closed session report. Nora?
Thank you, Mayor. Closed session was canceled this morning. Thanks.
Thank you. Next up is the consent calendar. Are there any items the council would like to pull? I'm not seeing anyone raise their hand. And Tony, do you have any hands there? No. Okay, let's take public comment then on the consent calendar as a whole.
Yes, good morning. Paul Soto from the Horseshoe. This, the consent calendar over the past, I would say probably 2 months, it's stacked with issues that in like maybe last year, you would see on the regular agenda items that wouldn't be on consent. And so there's a lot of money involved. There's a few, maybe, I don't know, about $15 million. And there's also zoning laws, and I don't know if this is like, it's just like a charade, like you act like it's not happening, and then everybody else acts like it's not happening. But that's exactly what's going on with that consent calendar, is that there's no kinds of challenge, there's no kinds of there's no means by which we can have explained how you rationalized placing these items on a consent calendar versus a regular agendized item. And so especially with respect to the zoning laws, I mean, we're like putting a filling over a cavity, because the redlining maps have not been central to any of these land use designations. And I think that it's irresponsible. I think that it's irresponsible and reckless to not put that as center focus with regard to the redlining and then move from there. Thank you.
Back to the mayor.
Okay, thank you. Is there a motion on the consent calendar?
Move approval.
Second. I'll let Tony decide who got that motion, but I heard the second from Councilmember Cohen. Okay, Councilmember Foley wins. Let's vote on consent. We'll do this by verbal vote because we do have members online.
Yes.
Cohen,
Aye.
Roscoe, Davis,
Yes.
Esparza, Arenas,
Yes.
Foley,
Aye.
Mahan,
Aye.
Jones,
Aye.
Liccardo.
Aye. Oh, we did, didn't we? Okay, I'm sorry, that was my fault.
I forgot to.
Yeah, okay. Do you want to,
I'm just going to count that as roll as well.
okay, you've just articulated the role. Very well. We'll move forward then to the land use consent calendar, which is 10.1. So we're skipping way ahead here in the agenda. Item 10.1. Is there any public comment, Tony? This is the only item which is the amendment to the zoning code.
I have no hands up.
All right. Any comments or motion from my colleagues?
Move approval.
All right, I see none of my colleagues with their hands up either to speak, so we'll vote.
Jimenez? Jimenez?
Yes.
Thank you.
Yes.
Morales?
Yes.
Cohen,
Aye.
Roscoe, Davis,
Yes.
Esparza,
Yes.
Arenas,
Yes.
Foley,
Aye.
Mahan,
Aye.
Jones,
Aye.
Liccardo.
Aye. All right, we're on to the report of the city manager. Jennifer?
Yes, thank you, Mayor. I have no report today.
3 point,
You know
Oh.
what? I'm sorry. I do have a report.
Okay.
I don't know what I was thinking. I just, you know what? Sorry.
It's always good to give it a try.
Yeah, tried. You have a COVID-19 update.
Thank you. And we do have a presentation if we can get that up. There we go. Thank you. Good morning, Mayor and Council. Lee Wilcox, Assistant City Manager, and joining me for the presentation today is Dolan Beckel, Interim Deputy City Manager and our Operations Section Chief in the EOC, Alvin Galang, Assistant to the City Manager, and our Vaccination Task Force Director, and Sarah Zarate, our Office of Administration, Policy, and Intergovernmental Relations. So with previous reports, we're going to focus on 4 subjects today and really try and focus the conversation around what's changed, what's driving that change, and anything that's new or that we'll be working on in the months to come. We're going to start with some highlights and recent trends related to COVID-19 globally and locally, updates around the Vaccination Task Force. Sarah will update on some advocacy efforts that we're taking on now, as well as kind of integrating some of our response and recovery efforts, which we briefly touched upon last time. I did want to start, however, we had gotten away from this in previous 3.1s, but highlighting some of the good work. And while we reported out to you last time that our city was 95% vaccinated, or those 12 and over at least had one dose, 95%, in these reports and in our actions in the EOC, we're taking more of our time focusing on the other 5%, and rightfully so. That is our way out of the pandemic and protecting our residents. However, I do want to use this time to talk about some of the efforts around that 95% before we make the shift in this presentation to talking about a different denominator. Because now that pediatric vaccinations are happening, the county is measuring by total population. So I do want to spend a little bit of time to recognize, celebrate, and appreciate all of the hard work behind our city and our residents achieving 95% of at least one dose or more for 12 plus. Obviously, we haven't done this alone. We've reached this milestone with a lot of contributions, collaborations, and partnerships and communications between a variety of stakeholders and participants. Each one continues to play a very important role in the weeks and months ahead. We look forward to continuing to partner and transition out of the pandemic into recovery. Us, the county, our education partners, our faith and community nonprofit partners, private healthcare providers, and most importantly, our residents who are part of a community fabric willing to protect themselves and others from the spread of COVID-19 have helped achieve this number. It occurred to several of us last week while we were at the San Jose Fire Department Award ceremony that we had gotten away from highlighting some of the good work in the Emergency Operations Center. So today I wanted to highlight the work of the San Jose Fire Department personnel, specifically over 100 personnel in the department that have been directly involved in COVID-19. These are pictures from the award ceremony last week where personnel were awarded for their efforts around COVID-19 and the vaccinations citywide. While the city as a whole is not directly in the business of vaccinations, our San Jose Fire Department personnel have been the city's most direct responders to this pandemic, being the only city representatives able and authorized to administer shots in arms. Our personnel staffed the Santa Clara County Fairgrounds first responder site, and that transitioned into a public site, helped stand up, operate the mobile vaccination site, administering vaccinations to individuals that face challenges from receiving vaccinations outside their homes, supporting the county and other providers at sites across the city, as well as sites that the city stood up, and helped the county and others develop tracking and communication strategies and methods of operations at vaccination clinics to ensure that vaccination clinics were most efficient. So I want to thank the San Jose Fire Department personnel and congratulate them on their awards. And now for a look forward for the work in the coming weeks, I want to hand it off to Dolan Beckel.
Thanks, Lee. Good morning, Honorable Mayor, council members, members of the public, and city staff. Dolan Beckel, Interim Deputy City Manager here to provide an update on recent trends in COVID-19. Given events over the weekend and today and the last couple of weeks, I've included a global update along with our standard national, state, and local. And we'll try to keep you as up to date as possible, but things are changing by the hour, especially on a global basis. So it was about 3 weeks ago that the global situation with COVID-19 began to change. These key changes included: 1, Austria, where 66% of the total population is fully vaccinated, is implementing lockdown procedures. Germany, where 67% of the total population is fully vaccinated, and Denmark, where 76% of the total population is fully vaccinated. Both have been added to the Center for Disease Control, or CDC, avoid travel list of countries because of the surge in the Delta variant. A new variant named Omicron is being actively researched and tested due to the large quantity and unique nature of the Omicron mutations. Travel restrictions are being implemented, and as early as an hour ago, the source location of the Omicron variant is now in question, so I would recommend anyone traveling internationally be sure to go to the Center for Disease Control travel website, because that will probably be changing on a daily basis. I would also, of course, check our county for any local guidelines as well. The World Health Organization, or WHO, is classifying Omicron as a variant of concern, while here in the United States, the CDC has not yet classified this variant. The United States federal government guidance on boosters was updated last night, and Sarah Zarate will be going in more detail about that change, about who is eligible and when they're eligible. More data is necessary for local policy consideration, and that will not be expected for several weeks. However, as President Biden said yesterday, sorry, flipped the page too soon. However, as President Biden said yesterday, the United States lockdown and shelter-in-place policies are not expected. In the United States, where 59% of the total population is fully vaccinated, the federal government is pursuing a national COVID-19 response policy, which had some setbacks last week, and Sarah Zarate will also be talking about that. So the bottom line is the COVID-19 Delta variant surge continues globally, while a new and potentially impactful variant like Omicron can emerge. The best course of action is to follow county and CDC guidelines, which include getting fully vaccinated and getting the booster as soon as you are eligible. Currently in the United States, the Delta variant remains the only variant of concern or high consequence as classified by the CDC. The CDC is currently evaluating the Omicron variant, and it will be added if the CDC determines it is appropriate. It is expected that eventually the variant will be detected here in the United States. Currently, as last time, there are no variants of interest, and there are 10 variants that are being monitored, none of which pose significant public health risks to the United States. California and Santa Clara County remain in the substantial or orange community transmission level, but as you can see on the map for the state of California, more progress has been made in the Bay Area, but California and Santa Clara County remain in orange or substantial transmission. California does have the lowest case rate nationally, and 67.5% of the total population in California have been fully vaccinated. Moving to the local level, as reported last time on October 26, county positive cases and deaths have flattened out relative to the significant wave number 4 last winter. They have not, unfortunately, returned to the single-digit level we saw before the arrival of the Delta variant in July. At our last report, Councilmember Reynes requested that we show the change in deaths related to COVID-19, and since our last report, unfortunately, the county has averaged about 2 deaths a day due to COVID-19. Some good news is that last winter, at this time, the case rate was over 500. So compared to 137 last week, this proves that the vaccines are continuing to protect our population. We did see a 25% increase in cases since our last report on October 26, and we continue to monitor the case rate and the deaths, and will include any Omicron variant impacts that have not yet been observed here locally. Hospitalizations and ICU bed are currently stable compared to last report, but again, they're only 28% of what we had available at the beginning of the pandemic. This situation has not changed much since our last update. The city of San Jose's full vaccination rate for ages 12 and above is 89.5%. The county is not providing city-specific data for full vaccinations across the total population. They are insisting that our focus be at the county level, so they are not providing city-specific data on full vaccinations across the entire population. The Santa Clara County full vaccination rate for the total population is 76.9%, up 3 percentage points since our last update on October 26. As of today, that was updated to 77.5%, so we continue to head in the right direction. The good news even though we have to use two different metrics here, one being for the city of San Jose, 12 and above, and one for the county being total population, the vaccination rates continue to head in the right direction. And of course, we have to continue to focus on that 5% and those census tracts where we have low vaccination rates, and that will continue to be the focus of our vaccination team that Alvin will be talking about shortly. In terms of the criteria to lift indoor health orders on masking, while the county has made good progress on certain areas, we still have much more work ahead of us, with 3 of the 4 criteria not being met. The only criteria that we may be getting close to is hospitalizations and ICU beds being stable, but we're going to have to wait and see if and how the Omicron variant impacts us here in Santa Clara County. As Lee Wilcox said earlier, it takes a team, and all the residents, healthcare workers, healthcare partners, and city employees should be very proud of the fact that the city of San Jose remains the most vaccinated city within the top 10 largest United States cities. There was some question about this from a certain council member last time we met, so I refreshed the data, and we remain for 12 and above the highest vaccinated of the top 10 cities at 95.3%. So that's where we stand globally, nationally, at the county and local. I'll now turn the presentation over to Alvin Galang, who heads our vaccination task force, to talk about the specific actions we're taking to ensure we focus on that 5% here in the city of San Jose. Alvin.
Thank you, Dolan. Good morning, Honorable Mayor, City Council, and members of the public. My name is Alvin Galang, and I'm the director of the City of San Jose's Vaccination Task Force. Thank you for the opportunity to present an update on the task force's role in ensuring that the residents of San Jose are kept as safe and healthy as possible, as well as an update on pediatric vaccinations among our 5 to 11-year-olds and new eligibility criteria for booster shots. As seen earlier, the City of San Jose has an 89.5% completed vaccination rate for ages 12 and above. Again, as a reminder, we will be presenting the data moving forward as available that focuses on completed vaccinations to align with the criteria to lift the indoor masking mandate. At several of the vaccination clinics that the city has coordinated directly with the county public health department, we have seen triple-digit attendance. For instance, at Emma Prush Farm and Park, they averaged around 200 vaccinations per day during the week of November 15th. And they currently operate between Tuesdays and Thursdays, Tuesday, Wednesday, and Thursday. And since our last presentation, eligibility for a booster shot has been expanded. What is driving the change? Since November 3rd, more of our kiddos are now eligible to receive a vaccination. And with the holidays and change in season and seasonal temperatures, folks are going to want to gather more indoors and gather more with family and friends to feel that greater sense of normalcy. So with that, they're looking to protect themselves, their family, and their friends by getting a vaccination. What's new? County Public Health and the Office of Education has designated the city's role to focus primarily on communications and outreach to our most vulnerable populations, particularly among the newly eligible 5 to 11-year-olds. The city will focus on connecting with and informing those that have agency over children. We are extending a pause on our wireless emergency alerts since we are currently experiencing high participation at our clinics. Also, the county has not made any direct requests for the alerts at this time. However, if or when the numbers do fall, or should the county make a request, we will reevaluate and reinstitute the wireless emergency alerts as appropriate. These are additional numbers that illustrate the vaccination rate by race and ethnicity in Santa Clara County. During our September council update, we had presented these numbers based on the data that was made available, which at the time reflected ages 12 and up with at least 1 dose. The numbers that you see today reflect ages 5 and up with at least 1 dose. And so again, aligning more with the population that is currently eligible. As mentioned before, the City of San Jose has an 89.5% vaccination rate, city residents aged 12 and up that have completed their vaccinations. And through direct partnerships with the county and our other partner providers, we have delivered nearly 30,000 vaccinations to date. And we have had 2.36 million resident impressions through our digital vaccine outreach efforts. These are the 13 current census tracts within the city of San Jose that have lower vaccination rates of less than 75%. And the task force will continue to focus outreach and communications within these tracts. And whenever possible and as requested, assist with the coordination of mobile vaccination clinics to serve these neighborhoods. With pediatric vaccinations, we will continue to support the county and the Office of Education in reaching our non-English speaking communities with a focus on reaching people who have agency over children. Our current efforts in the county of Santa Clara, or our current efforts citywide, we have 24.7% of our 5 to 11-year-old population that have received at least one dose. And our kids have been receiving their vaccinations through the county of Santa Clara, 46.8%, which includes county health and hospital systems, our mobile vaccination clinics at the schools and our community locations, 17.5% through Kaiser Permanente, 14.4% at pharmacies, including Walgreens, Rite Aid, and CVS, 12.1% at other entities, which include Stanford, Palo Alto Medical Foundation, Sutter Health, and then outside the county healthcare systems, 9.2%. With the boosters, originally the CDC recommended boosters for those 50 and above or 18 and above in long-term care setting, and those between 18 and 50 based on their individual risks. However, it has been expanded to all adults. Bottom line is just all adults, anyone age 18 and over, and 6 months have passed since they've completed their vaccination with Moderna or Pfizer, or 2 months have passed since they've completed their vaccinations with Johnson & Johnson. And I believe Sarah will talk a little bit more on advocacy. So I'll turn the presentation over to Sarah.
Good morning, Mayor, council members, and members of the public. My name is Sarah Sarate, Director of the Office of Administration, Policy, and Intergovernmental Relations. Since our last report, in response to the President's Path Out of the Pandemic Action Plan, the U.S. Department of Labor's Occupational Safety and Health Administration, otherwise known as OSHA, announced a new emergency temporary standard to protect more than 84 million workers from the spread of COVID on the job. However, a few days later, on November 17th, OSHA paused implementation and enforcement on its emergency temporary standard following a stay granted by the Fifth U.S. Circuit from a lawsuit seeking to block the mandate. The stay is being implemented nationwide. No additional timelines are currently known, but the Biden administration is appealing. Additionally, as noted by Alvin just now, the FDA authorized and the CDC endorsed COVID vaccine boosters for all adults. Most recently, as you know, and as Dolan talked about, on Friday, the World Health Organization designated the Omicron variant as a variant of concern. In response, the President, following other nations, restricted travel from South Africa and 7 other African countries. Additionally, yesterday, the CDC, which had previously made distinctions between what adults, quote, should or, quote, may get booster shots, shifted and strengthened its language, recommending that all adults should get boosters. Lastly, here in California, the Department of Public Health said Sunday that it plans to increase tracking the variant through genetic sequencing and continuing to promote vaccines and booster shots. And with that, I'm going to pass it on to Lee.
Thank you, Sarah. Just wanted to end on some integration of some of our efforts, and obviously a lot is changing and changing daily and weekly. And one of the things that I think we learned early on in the pandemic, especially when there's this much change and this much information, is residents can be overloaded. Our public can get overloaded with information. And so I know I touched upon this last month, but we're really going to work to integrate parallel communication efforts to our residents to ensure that we can target the most vulnerable with a combination of important messages versus a lot of different messages. And so this will be very specific to the vaccination task force and vaccination efforts in the EOC, as well as all the recovery efforts and the residential assistance programs that are available now and that will be available in the future. And so I wanted to talk about that and warn you. Under Carolina's leadership, she'll be doing that over the next month, along with the recovery section with Rosalind Huey. And I mention that because I think one of the more successful things we've done is Carolina every week sends you a toolkit or communication package to put out to your residents. And by the way, thank you very much for doing that. You have a wide network as well. You'll start to see that those messages are going to change, and they'll be a little bit more concise and have a few different messages versus a lot of different messages about one thing. And that really comes from the behavioral insights work that we did early on in the pandemic, as well as the county and other partners. And this is really an effort to target those who need it the most with the most important messages. So you'll see those messages start to change over the next month, and we'll report back on that in January. And with that, that concludes the presentation, Mayor. We're available for questions.
Thank you, everyone, for all the great work. Let's go to the public first.
I have Blair Beekman.
And this is on 3.1, the report of the city manager.
Yes.
Hi, thank you. Blair Beekman here. Happy morning to everyone. Thanks for the report. You know my feelings about, the overall, I've been trying to practice for a few months now that, how we're going to talk about the future of the vaccination process. We have to learn how to do that better. I'm making my own attempts. I hope yourselves can as well. Lee just explained some nice things, what you'll be trying to do with the vaccination process in the next month. But boy, if we learn to talk about the process, what exactly is the importance of the vaccine process and how it can be of help, how it can be a part of our future regular lifestyle choices, and what that lifestyle choices mean in our relationship with our computer technology and with our just day-to-day living situations. It's important to learn to explain that better, and that has to learn how to be more clear and open. I've been trying to describe for months now that, we're going to have a new variants coming in. We have to prepare for that and be ready for that this winter, and now it's starting up, and we're getting ready. So, good luck to our ideas of better mask use, and a thank you that I think we're trying to be open to offer all points of view, how people feel about the vaccine process. And if people are uncomfortable with it, we're learning to make room for that. And it's an important thing I hope we can continue to work on while still practicing community safety. I guess that's about all for myself. A final reminder that, the importance of, open, accountable technology practices can really help facilitate decent conversations for all sides about the future of vaccine use and our future with COVID-19. So good luck with yourselves and the work you'll be doing in the next month. Thank you.
Paul Soto.
Yes, good morning. Paul Soto from the Horseshoe. A couple of things. Number one, was there any updated data with respect to the Asian population? The last time that you gave a report, the Asian population was at like 99% vaccinated. And, I didn't know, a couple of council members accepted that as a legitimate number. So I'd like to know if that's been amended, and if so, what that number is. Number two is there wasn't any information about the reinfection rate for people that are vaccinated. And I think that if we put that into the public domain, that we will get a more comprehensive view of what it is that we're actually dealing with, and whether or not these I mean, not that we wouldn't be cautious, given the vaccine, but it's a reality that I think, given the report, it would be incomplete without that data in terms of what it is that we're looking at. So I'd just like to know those two things. Thank you.
Back to the council.
All right, back to the council for questions. I just had one brief one about the texting app, which I think has been very effective. I assume when we see the lines go down for the clinics, we'll be resuming the use of that. Is that right?
That's correct, Mayor.
Okay, great. Councilmember Esparza?
Sorry, did you mention me? Thanks.
Yes.
Yes. So first off, thank you, and thank you for including good news. I think it's important to celebrate good news and acknowledge the hard work that everybody's putting in. So thank you for that. I also really want to give a shout out to Santa Clara County Public Health and you, Alvin. You've been really, really extraordinarily helpful to coordinate community-based vaccinations. And I have, in my experience, we're open to doing crazy things in District 7 as long as it works, right? And so we've done a lot of those things, and it has made a difference, and that partnership has made a difference. And in fact, public health has often been surprised at how much the community has turned out. And so I just wanted to acknowledge that and say thank you. A couple of things caught my attention today. One of them is I'm interested in hearing more and talking more about city-specific vaccination data. San Jose, during COVID, had 2/3 of the county's COVID cases. And then most of those numbers have been in East San Jose. And many of the essential workers that live in Santa Clara County, in fact, many of the workforce for other cities live in San Jose. And so why do we not have city-specific vaccination data so that a city like San Jose, which has been so tremendously impacted by COVID, can measure our way out of it?
So Councilmember Dolan Beckel here. So we do have that data. We've been presenting it at kind of the policy level, which is the total number. We can certainly go back to we previously did present that data, I think, by census tracker, by zip code, and we certainly can go back and do that.
Okay, that would be helpful. So I'm glad that I followed up because I was confused by the mention in that presentation. Particularly, I know we all pay attention to that data, particularly in areas that have been really hard hit, where we do think of the crazy ideas. I know Councilmember Carrasco and Councilmember Arenas, we've been out there doing some interesting things to get people vaccinated. And it's something I pay attention to, and it's a useful tool. So that would be helpful. Thank you. So I read, it wasn't in this report, but I had read that Santa Clara County, due to the great work that everybody's doing, is in the top 5 counties in California for vaccinating kids 5 to 11. I think that's pretty extraordinary that we came out of the gate, and it's in really result, I think, of all the partnerships that have been built up over the past year and a half. The projections before Thanksgiving showed an expected increase due to the gathering in Thanksgiving. So I have 2 questions related to that. One is, how are we preparing for COVID testing? Because all the projections showed COVID cases were going to shoot up because people were coming together. So how are we sort of preparing to test people and respond to an increase in COVID cases? And then 2, how are we preparing for the next holiday that's coming, where we know more people are going to gather and travel, so that we can minimize those impacts to our city?
So Councilmember Dolan again. So the county and the city are both tracking the case rate and looking at the hospitalizations and determining if actions need to be taken. We flattened out and things are stable. And we've gotten actually through Halloween, and in another week we'll be through Thanksgiving. So we're keeping a very close eye on that. We're also coming up on month 5 of the wave 4 peak. And generally, whether you look at 1918 or you look at this pandemic, if we've gone more than 5 months, we've kind of gotten out of it. So we're looking at duration, we're looking at it, the intensity, and we're looking at the hospitalizations, and we are ready to take action, but we're not seeing it in the data to justify taking action based on the capacity we currently have.
Okay, thank you.
And I would just say, so Dolan is absolutely right. One thing that the county did do in August and September, when I think it was more August when the Delta variant showed up, was to just purchase additional capacity for testing as well. So Dolan is absolutely correct. The policy really hasn't changed because of where the data's at, and they kind of thought that if the data shifted, it would really be after Thanksgiving and to make that choice. But they've given an awful lot of testing capacity to the pharmacies, to the school districts that are now in schools, and that are holding back themselves so that they can ramp up capacity. So they do have resources and operational capacity to meet that change if the data warrants, more communication or more testing.
Okay, that's helpful. That was my next question, was about the capacity for testing. So for example, the Evergreen School District is a partner to County Public Health to provide testing for the East Side, not just for Evergreen School District families, so that they can do that testing. And so my follow-up my next question is on the messaging, right? I think that's one of the things that we need to include on the messaging. Is I agree it needs to be really simplified. Some of it has been confusing, and I don't mean like ours or the county. I just mean in general. Like, I don't think the public cares like who's saying it. They're just getting a lot. And so I think simplifying it, but also reminding folks that they still need to get tested. Testing is still a thing.
That's a great
and
point.
It's going to be a thing, especially as people are gathering, because if we remember, gathering was the #1 way to get COVID, and it still is, right? So, okay, that's very helpful. And because I mean, I'm hopeful. I think if we can make it through this winter, like it'll be good. I think because we're natural optimists. The other thing on messaging was two more things. One is I think we have. I really appreciate getting Carolina's emails and all the information. Okay, here's the testing sites. In District 7, and I'm sure my colleagues do this as well, like we share on social media, but we also go to partners in neighborhoods and work with specific neighborhoods to get that information out. And some of the sites have been recurring sites, and other sites are shorter term. And for the shorter term sites, to get a 24-hour notice that there's going to be a vaccination site isn't helpful. And I know we're getting it as soon as we get the info, but anyway, just to kind of emphasize that point, that if something's going to be a shorter duration, in order to be more effective, we need to get as quick notice as we can, so that we can reach out. And that's part of that partnership that makes these sites more effective. The last thing that I wanted to address was a couple weeks ago, when boosters came out, there was a site in my district that had seniors being turned away because the site was overwhelmed. And a lot of the folks were monolingual. I don't know about you, but when my mom goes to the doctor, like it's a thing, it takes a while, like there's a cup of tea involved afterwards, and so to get somebody, in a walker or something out to a site, and they're physically in line, and they get to line, and then they're told they don't have an appointment. I did have some conversations with the county afterwards, but I think we need to be mindful of that, because I do think there are a lot of folks, it's a great problem to have. We're a community that believes in vaccinations. Our folks want to get vaccinated. And so I think that as much as we can help, because we're the city and we're sort of the town square. The county's the safety net, but we're the town square and we're out there on the ground all over San Jose. And so as much as we can provide help on that messaging and assistance, if they do think that they're going to get overwhelmed, how can we partner with them to provide alternate sites so that somebody's not wasting that trip? Because it does take a lot out of you, right? I mean, so anyway, that's sort of my last request is I'd like to really partner more with the county on that. I don't want them to feel like they're alone, but we need our community vaccinated, and how can we work together to get that result?
Council member, this is Dolan. I will reiterate that and help message that because I kind of went undercover yesterday to get my booster shot at an East San Jose site and saw a very stressed out doctor
Mystery shopper.
it was Montpellier, a lot of Vietnamese people showing up, and so I think we need to tighten up the difference between an appointment versus a show up. That was some of the problem, was it just said show up, but they were also taking appointments, and so people were showing up thinking it was just get in line, and they were trying to manage appointments with people who showed up, and the communication can be better. So I'll take some of those personal experiences as well to work with the county.
Yeah, and how we can message that, because I've been out to many sites in the past few weeks in my districts. I've gone out personally to them, and I've witnessed public health being amazing when someone says, yeah, I don't have an appointment, I got here, and they're like, you know what, sit down, we'll figure it out, right? I've seen them do that over and over and over again. So they do try and resolve it. So, but the chaos, or worse, turning people away is not something I don't think the county wants, and it's not what we want. So.
Right, and I see some areas for improvement there.
Thank you, appreciate that. That's it for me, Mayor.
Thank you, good question. So Councilmember Foley?
Thank you for the report. Thank you for the positive numbers regarding the vaccines, and I'm hopeful that the younger kids will start getting more and more vaccines in that regard. But here we are again a year later, and we were shutting down businesses, we the county, let's say, we're shutting down businesses because of a spike. Now we've got Omicron, and I know Omicron isn't here technically, at least we don't have it identified yet, but Fauci and everyone else speculates it's here. So the question I have, and Dolan, maybe you mentioned it, the state, are we hearing from the county, the state, or the federal government that they intend to start shutting businesses down again, or what's your communication with on the county? I'm very concerned that we're going to go back again when these small businesses are barely surviving, and what we can do to make sure that doesn't happen, all while we are still protecting each other against COVID.
Right. Thanks, Councilmember Foley. And I think Lee had a recent conversation with the county, so he can weigh in on that. But I'll go out on a limb here and say my professional observation is in the last 4 days, there's been a huge overreaction, right? Both the equity markets, the press. So here's what we know is it started either in the Netherlands or South Africa. We don't know where. When you contact those locations for vaccinated and unvaccinated, the symptoms of the people who test positive is very mild. We do not, even though there's a lot of mutations in the area where it enters the body, there's no indication that the vaccines aren't effective. President Biden, having been briefed by a number of people and having been exposed to the Israeli data on this and the South Africa data, publicly stated we will not be going back into lockdowns and shelter in places. I think what you'll see is maybe we have to have boosters more often. Maybe it has to be a different booster. But I think that's kind of where we are. It's another variant. It may or may not be treatable with the current vaccines may be largely effective or slightly less than that, but they are going to be effective. So it's probably a matter of time and the type of and duration of the booster shots. in the same way that we have to have boosters for the shingles. Like 2 years ago, we had to get our Shingrix double shots, right? So we're kind of entering that mode where these variants are going to come up. We're going to have to do the science, but given the vaccination rates that we have, the reason that first slide, I don't know if we can go back to one of the slides I had, but if you look at where there's lots of cases, it's where the vaccination rate is below 30%. If you look where there's a handful of cases, it's the slide on, back to slide with the planet. If we can go back to slide,
I think it's 12.
12. Because I kind of want to make this clear. Can we go to slide 12? Do I have the clicker?
Mm-hmm.
In those areas where the vaccination rate was 60, 70%, they've reported 2 or 3 cases. So as Dr. Fauci said, it's not just me, we have no data to believe that the vaccines aren't effective. We need to do the testing on the mutations to see what actions we take. One more. Back one more. Right. So expecting this question might come up. South Africa and Botswana have 23% and 29% full vaccination respectively. They're having thousands of new cases, and when the interviews with the doctors say the symptoms are very mild. If you go to Hong Kong, which is 62% vaccinated, they've had 2 cases. If you go to Israel, they've had less than 10. If you go to Belgium, they've had less than 10. So right now, we have no reason to believe that the vaccines aren't providing a certain degree of protection, and we need to wait for the data. So that's a long explanation to know people should not be expecting shelter in place or lockdowns. There may be some tweaks to local health orders, and I think Lee has had some discussions with the county and can probably complete the answer.
Thank you, Dolan.
Yeah, Dolan said it better than I was going to, but I will say I was able to participate yesterday on a call with CDC. One of the doctors there specifically, called out places like the Bay Area and California for it not being a worrisome state because of our vaccination rate. So I think that's one thing. Had 2 conversations with the county, and I asked just about the indoor mask mandate and the framework. Was that going to change? And they weren't even having that conversation yet based off of the data they were seeing. So I think Dolan's right. If we start seeing changes, it'll be tweaks to that framework and some local protections to get us through these winter months, because maybe that framework arrives too early for us, given our vaccination rate and what's going on around us with visitors. But I don't, in any of the conversations I've had, I have not had that come up or even kind of construed until the president yesterday clarified that. That was the first time I had heard it.
Good. Well, I thank you for that, and I think that's really important. I think many of our small businesses are starting to worry about that we're going to be back where we were a year ago, and it will be reassuring to message that somehow with our community just to settle their concerns a little bit. And I know in the last year and a half or so that we've been living with the pandemic that the Delta variant was not the last variant that we were going to be hearing from, and we've heard that we will be hearing about variants a long time. I hope the booster shot, if there's another one, it doesn't knock me out like the last booster shot knocked me out for 3 days. So, but it's worth it to have it, and I'm glad our vaccination rates are as high as they are in San Jose and Santa Clara County. Thank you for that. That's it for me. Thank you.
Thank you. Councilman Carrasco?
Thank you. And my apologies, I wasn't here for the full presentation. I am looking through the slides that were posted on Granicus. But a couple of questions, and I don't know what page it is. Oh, never mind. It has the page here. Could we go to your slide number? Number 12. I want to look at slide number 12, as well as, well, let's start with slide number 12 for now, because I don't know where the other one went. So I see 76.9% and 89.5%, which is fantastic. And I want to thank all of our partners and, of course, all of you in the county. I want to thank my colleagues because I know that they've pushed so hard. Gotten midnight phone calls from some of my colleagues trying to be very creative and also up in arms when these numbers weren't exactly what we're looking at now. And I appreciate it. The urgency was felt. What I wanted to ask, though, is, and I haven't looked through the entire presentation, so forgive me. You can point me to the slide if it's there. Is this information disaggregated by demographics? What slide is that? If it's disaggregated?
We don't, this information in this presentation is not disaggregated.
Could I have you in the future bring back the disaggregated information? Because as you know, in the previous, 18, 24 months or whatever it's been, we've always looked at it as a disaggregated slide so that we have a better understanding as to what we really need to be looking and concentrating on. And of course, we know that our essential workers were people of color, specifically Latinos, Black, Asian, and the biggest concern that we had, of course, were our Latino population, given that they were the ones that were really trailing behind. Do you have information on our Latino population and how they're doing?
Yeah, we do. So the first thing, thank you, Councilmember Cross. So Councilmember Esparza asked the same thing. So we will be, at the next presentation, we'll provide some data aggregated by especially like location, like zip code or census tract, so you can see East San Jose.
Well, I don't want to just see East San Jose. I mean, it's helpful, but I do want to see in general.
Yeah.
Because when I look at Santa Clara County, 73% vaccinated, and I know that the Latino population is about 26%, I can kind of do the math, and it scares me a little bit to think that those who are missing from that equation might still be the bulk of the folks that we were always fearing. So I'm eager to celebrate, but there's a piece of me that's not celebrating yet. Because those still, if I'm looking at the most vulnerable, they're still unvaccinated. And so I'm not uncorking the champagne yet.
Correct. Can we go to the census tract slide, which is further down? Can we just page down until you see a long list? So we are going to continue to focus on these 13 census tracts, and which have historically been the least vaccinated. And with a bit of prefacing, we'll bring the data. The county has admitted they have a problem with some of the data, and sometimes the numbers are not aligned. We saw it with Alviso in the post office boxes, and we've seen it in other places where the number of people vaccinated are actually higher than the population in that area. So we will bring you that data, I will just be aware, I will point out areas where we think that the data may be slightly inaccurate.
And when you say that, you mean the number of vaccinated folks or the folks, what do you mean by, where's the discrepancy? What are we talking about exactly?
The discrepancy comes in the population of an area versus the total people vaccinated in that area.
Okay.
And we'll make that more clear when we say. I think a good example was Councilmember Cohen, who noticed that there are some post office discrepancies causing Alviso to be lower vaccinated than it actually was. So there's other examples like that with the county's data, that sometimes the data does not always align with reality, and we will just point those out, but we'll be able to bring that data to you.
Well, that's a nice error to have, knowing.
Yeah, exactly, right.
But if it were the flip side, where we think that they're vaccinated and then they're not, then that would be a real huge, that'd be a huge concern for me. So, so yeah, if we could have it, if we could have something that we could be looking at. Again, when I look at the numbers, of course, you know, it's promising. They keep going up, but are they going up in those vulnerable communities, are we actually making any sort of headway? Are we getting to them, or are we at a standstill? You know, are we in still waters with them? And then, and I don't know which slide this was, there was a number there that said 89.5% of 12-year-olds and above are fully vaccinated.
Slide 12, please.
Oh, is that 12 again?
Yeah. That was it.
Oh, that's, so we're going back to that one. No, there was another one that I saw. My
Then it
apologies.
rolls back on slide 17.
So there must be a slide in here that actually speaks to our kiddos and how we're doing with our kiddos versus adults, right? This is the new population that we were targeting.
Yeah, Alvin, you want to take that?
Again, my apologies, I came in late.
Yeah, Councilmember Carrasco, citywide, 22,143 or 24.7 of our 5 to 11-year-olds have received at least one dose.
Okay. So we have a lot of work to do with the little ones, yeah.
We do, but I would like to point out that the national vaccination rate as of last week for 5 to 11 was 7.5%. So we are 300% ahead of the curve as showing our focus on the kids and those geographies. And to your point, we will come back with some better measurements of next time we report back.
Again, with the disaggregated demographic
Yeah,
info.
segregated, right.
For the kiddos. Thank you so much. I really appreciate it. And again, as Councilmember Esparza said, you know, we have to make peace knowing that this is the way that life will be moving forward. Someone said something about shingles. Had I known what shingles was, I would have gotten the booster. I got it during the pandemic. And it was the most horrific experience I've had in my adult life. I had no idea what it was. I thought it was a backache, and it surely was not. But it is just going to be something that we have to live with and understand it and make peace with it. Of course, this is just the beginning of it. And so we've been in crisis mode. But we will have to at some point change our messaging and learn to live side by side with it. There's no other, I don't see any other way out of this. I do like something that Councilmember Esparza said. You know, we are a community of vaccines. We you know, this was a new one. So this is, I think, this was the fear of it. It was a new vaccine, and I think that was the fear for everybody: black, brown, white, blue, yellow, whatever. Your country of origin, the hue of your skin tone, your socioeconomic status. It was new. It was uncharted territory. It was frightening, and you know, the conspiracy theories begin to rise, just like in anything, because we need to justify what our fears are. But like the flu and chickenpox and measles and rubella, it's here to stay, and I'm hoping for the best. And I do hope that understanding how this now saves lives after we've lost so much, that will be the beginning of our peacemaking with it. So thank you so much, and I really appreciate it, and my apologies again to all for having come in late.
Thank you. Councilmember Arenas?
Thank you. I'm really grateful for this report. Also that, Councilmember Carrasco, you have a champagne bottle. You're not uncorking it, but you, at the very least, have it in hand. You just chilled, right? Chilled and ready to go. So I'm also with you on that. But there is a lot to celebrate because we've seen the progress over time. These are different issues that we're bringing up. Some of them are similar because logistics are logistics and people are people. And so I think, you know, you'll work through some of those things. I really appreciate the undercover. In my mind, I thought, you know, maybe those dark-rimmed glasses and mustache kind of a thing. And so I was thinking, are you going to do that in all of our districts that have high contraction rates? Because I would love that kind of. No, I'm not kidding. I'm not kidding. It's like just a checking in.
We can certainly find ways of getting boots on the ground feedback to help us with that. I actually think that was helpful, and that shouldn't be that hard to do.
And I would just say, I mean, Alvin doesn't speak about it enough, but as Councilmember Esparza mentioned, a great majority of our employees live throughout the city. And Alvin, being a longtime employee, has been able to tap into a lot of those people to ask about what their experience was and then funnel it back to us when we're having conversations with the county or others. So, I would have liked to have seen Dolan in a fake mustache as well, quite frankly. Maybe we can make that happen. But, I do think, employees bringing that back has been super helpful in our messaging and when we're doing partnerships with various partners at those facilities. But it's definitely something that we can intensify.
Let me add to that because Nancy, who's my deputy chief of staff, said about 2 weeks ago she went to the Flanagan and King site, and it was fast and easy. So it is working. I think there's probably some off days. One of the things that I wanted to bring up that's slightly different, because I didn't want to underline some of the comments that my colleagues have made, especially the breaking down of the information. But you've heard it before, so I'm not going to go into that. But what I am going to go into is that in the past, our messaging and our marketing has been very specific to different populations. This 24% for 5 through 11, we need to have a different messaging for them. The governor did a huge $1 million raffle. I, as a parent, am having a really difficult time convincing my 7-year-old because I don't want to, I don't want to have that ugly picture, and I don't want her to have that ugly picture in her mind of being forced to have a vaccination. And so when she had lab work done, it was like weeks and weeks of talking her through it. I had to commit to 3 toys after, we have to take like the metaphoric lollipop and stickers, like what are we giving our kiddos and how are we working with the schools in order for them to get through this? Because if my kid is like any other kid, they're afraid. Right? And they just don't want that needle in their arm. But they do like gifts. So what are we doing? What are we working on that speaks to children?
So one way I would say that is we can come back and give you a much more detailed description from Carolina when she's back. Carolina is taking it's her child's birthday. And so she's gotten the first day off in a while. I do know last time she talked about, we remain focused on the most vulnerable, but we are pivoting to the 5 to 11 away from, not away from, but a focus on the 5 to 11, including the 12 to 17 Latino AX youth who are the next hardest to kind of get to. So we are pivoting, and some of the tactics around that, I just assume we let Carolina address those when we come back in January.
And yes, absolutely, we can do a deeper dive. I will say a lot of the sites are doing some type of gifts. I know I had similar conversations with my daughter, and so there was ice cream involved.
Wow.
And gift certificates from 31 flavors.
Okay.
One of the things that the county did with the schools is when they did focus groups with the 12 and over, but they also did some with 5 and 11. And a lot of it actually is happening at the schools. If they want to continue playing band, they need to be vaccinated. If they want to be on the soccer team, they need to be vaccinated. If there's after school clubs at the elementary schools, they're going to need to be vaccinated. So I know that that's a big part of what's been going on thus far, but I do know Carolina's in numerous conversations about this, so either through info memo or in January we can follow up.
Yeah, I don't know that every district is doing the same things. My son was in cross country, and they didn't ask him for a vaccination proof. He does have it. And Councilmember Esparza just mentioned that kids are very good negotiators, and so I think the 31 flavors is a starting point for you, Lee. You never know what you're going to end up having to purchase for that vaccination. But getting back to the seriousness of this, because after holidays, our children are one of the groups that are on a daily connecting with 30 different households and more, right? And so, and in very close contact, even if it is, separately, it just inadvertently, you're going to touch something somebody else touched, blah, blah, blah. So it would be wonderful I'd love for us to work together so we can have some of the school sites. I know play space was really important. For me in Eastridge, our roller rink is back in business, and I'm really happy for that. And for them to have their business open once again, but that means a loss of a site in that area that was very productive. And then the last thing I was going to ask is about our own requirements for vaccinations. Are we doing that for our recreation and preschool? Is that somewhere we're going to end up at?
Yeah, it's something that we're reviewing now with all the various programs, and kind of to Dolan's point, we're really seeing where the data goes. So we'll be making decisions, I would say, like within the next month about those programs, as well as any follow-up ordinance for city facilities related to 5 and 11 as well.
Yeah, I have somebody who is in the same school district my daughter is in, and I just remembered what she was telling me was that they were testing there, and then all of a sudden she got like a bill for 3 or 4 tests that were going to be, a high cost for her, and if she had another option, which is our county, I mean, it just works. And so I think there's a lot of parents who may not, the schools sometimes get a little burdensome with forms and consents and whatnot, and they're not, I don't think, being very clear about the actual end cost to a family for either testing or vaccination. So I think that's another thing that we need to make sure that when we work with the schools, that we figure this out. And then I'm guessing that you're going to have some kind of plan for after the holidays to ramp up in those areas where you're all shaking your head yes. So thank you. I appreciate that. And thank you for all the really great work. Once again, I'd love to see the breakdown of those numbers. I know it's out of your control, but the advocacy is all yours. Thank you.
All right, any other questions? All right, I think this would be a good time for us to take a quick break for lunch. So thank you all for the presentation. We'll take a break for lunch and then resume at 1:30. Unless there's any objection? Okay, thank you, everyone.